Another insurgent down the road to the left. Another insurgent down the road to the left. Combat activity going on nearby. Combat activity going on nearby. For 15 years, virtual reality has been an increasing area of research and endeavor, not only in medicine, but also in mental health. And it's also being used with attention deficit. It's being used with people that have speaking difficulties, or it's being used with individuals that have fear of heights. The idea is an exposure model. That thing which we have a fear of, we typically avoid. And one aspect of PTSD is an avoidance diagnosis as well as an arousal diagnosis. RPG launch. This proprietary investigation, specifically with about 50 warriors here at Balboa. We found out what was it about combat that for them was arousing, and what was the combat environment like. We asked them for photographs, we asked them for stories, we asked them for lines that they remembered in terms of things being said to them or statements that they made to warriors when they were deployed. The Virtual Reality Medical Center took that information and developed a proprietary software that has a visual stimulus of a combat environment. And it also has what we call elements, and the elements are different types of combat sounds: rapid gunfire, distant gunfire, single shot gunfire, helicopter sounds, communication sounds, information that sailors, Seabees, or Marines might say to each other in a combat environment, like get down, or he's in the building. Off on the right, the top of the building, there's an insurgent with an RPG. And we also keep an eye on our warriors' biofeedback. So we monitor heart rate and respiration rate and skin conductance and peripheral temperature. The idea with arousal, you have increased heart rate, and you have increased respiration, you have increased skin conductance, and you have decreased peripheral temperature. What you're viewing are just reminders. So we see that is what's going on with our warriors when they're in the combat environment, a simulated environment, to remind them of what they maybe experienced during the time that they deployed. There's already been a robust amount of research that shows to do simulation training with warriors prior to combat deployment gives them increased tools of war, and we think would decrease the difficulties they may have due to PTSD because of exposure to combat, either during one tour or during multiple tours. And so the next step can be to do research to train our warriors to increase their ability to be relaxed and be focused and to resist arousal difficulties in combat that would lead to PTSD.